Hello and welcome to India Top Doctor. Today we will talk about hypertension and exercises. And for that, we would like to invite Dr. Mitshu Doshi. She is a specialist in cardiothoracic. She has been practicing for 14 years. She sees patients with heart disease, high blood pressure, and diabetes. She's the director of the Mobility Clinic. The Mobility Clinic is one of the revolutionary clinics serving exceptional customer or patient services. It has a unique concept in the physiotherapy field, like cardiac rehabilitation and podiatry as its basis of services. So let's welcome her. So welcome to India Top Doctor. As you know, today we'll be speaking about hypertension and exercises. So can you tell what is hypertension and what causes it?
Yes. So what causes hypertension? The first I said is smoking. As you waste nicotine, your arteries get blocked because of it, and there is a chances of getting hypertension, that's high blood pressure. Being overweight for a longer period of time, taking too much of salt in your body. When you take too much of salt in your body stores extra water, which raises your blood pressure. So excess intake of salt, too much of alcohol consumption, stress. So when you are stressed with your maybe your personal lifestyle or your work profile or any other thing, there are certain hormones released in the body which gives you blood pressure. So stress, family history. You have a family history of your parents or grandparents or brothers, sisters can also give you a blood pressure genetically. And sometimes insufficient intake of your calcium and magnesium also gives you blood pressure. Sleep apnea, sleeping disorders can also give you high blood pressure. So these are all the essential causes of hypertension. The secondary causes, because of certain things, the BP can come. So secondary causes are, say you have a kidney disease for a longer period of time, can give you a blood pressure. If you are diabetic for a longer period of time, there are chances. Women having thyroid for a longer period of age can also give you blood pressure. So these are the major causes which can give you a high blood pressure.
All right. So what role does exercise play in hypertension?
Oh, that's a good question. So basically what happens is when exercise, always we have an option. That thing is, why do I need to, it's just a BP. I have my tablets and my BP should be in control. That obviously works for it. But whenever you exercise, there is something called as post-exercise hypotension, which we call as PEH. So whenever you exercise, say for example, 30 minutes or 45 minutes, this mechanism of post-exercise hypotension sustains in your body for 13 to 14 hours, okay, which causes the reduction of the noradrenaline by inhibiting the sympathetic system, which is a cycle which reworks in your body, which helps to reduces your blood pressure. So ideally, when you have a resting blood pressure, which is a higher one, and you exercise, your body goes into this mechanism of PEH, which is, as I said, post-exercise hypotension, which helps to control your blood pressure in your future. But the problem is the effect of PEH stays in the body after exercise for 13 to 14 hours in humans. So ideally, you should be exercising regularly to get your blood pressure in control. That's how it works in the body.
All right. And is there any type of exercise which should be avoided by someone with hypertension?
Ideally, as I said, there is nothing where you can avoid any exercises. It just depends on a person's physical condition, at what age exercise they are doing. Sometimes the restriction could be because of a knee pain or any other issues. But ideally, if you ask that any particular restriction for the hypertensive patients, I would say they should be avoiding, when they're doing exercises, they should be avoiding something called as Valsalva maneuver. Valsalva maneuver is whenever you do exercises, you should not be doing forceful expiration. When you do forceful expiration, your blood pressure tends to increases. Also, the precaution they could take is when they're doing weight trainings, when they're doing, they can do cardio, they can do weight, they can do resistance pertaining to their age capacity. If they are doing a weight training, start lifting weights more with your upper body. Okay, gradually you can go to your lower body weights and your limb weights, which helps to give a better result in the exercise per se. Other precaution they should be taking is these patients or hypertensive patients are on tablets of BP. The contents of that is a beta blocker. So sometimes beta blocker alters your heart rate. So you don't get an exact intensity for workout. So when your therapist is making you a workout, they should be taking care of these beta blocker thing, which is if they are on a medications. Hydration is very important because sometimes the high blood pressure patients are taking calcium channel blockers. So during exercises, taking enough sufficient hydration is very, very important. That is a major precautions you can do as per the BP is concerned while doing exercise.
And how does lack of exercise cause high blood pressure, if it is even true?
How does the lack of exercise? So, whenever so as I explained that when you do exercises, your pH system is coming into the picture. Okay, if you are not doing the exercises, you are containing your lifestyle changes as well, your smoking, your other habits which are there. Exercise is making the flow which to be happen in your body, the system of post-exercise hypotension, which should come and which is not coming because of the exercises. Lack of exercise will definitely give you more rise of a blood pressure. So ideally, the lifestyle modification changes should be your diet, your exercises and medicines. All these three goes hand in hand, which will help a patient to be ideally fit with the exercises and to control the blood pressure.
All right. And can you tell our audience how is Mobility Clinic bringing new methods to cure hypertension?
Surely. So we do run our clinic with all these metabolic cases, which we call as diabetes and blood pressure and everything. A new concept which is called as heart rate reserve, which we call as HRR. Okay. So when you have a blood pressure or any other related risk factors, individually we do a exercise testing. So this exercise testing will help us to know how much exercise a patient should be doing. Sometimes there are people who would say, I work out for 2 hours a day, but I don't see result in me. Okay. So we don't want a quantity workout. Via this exercise testing, which we do it individually, we calculate the heart rate reserve of the patient, which we, as per the heart rate reserve, an exercise prescription is planned. So even if that heart rate reserve which is calculated and in those say 30 to 40 minutes, if they reach those targets, they are well enough to get the control over the BP. So we believe that they should know the difference between physical activity and exercise. They should be knowing the difference in a quantity workout rather than a quality workout. So this is what Mobility Clinic is bringing, to have a quality, to have a proper workout as per their condition, customized exercise programs. It's not, the exercise prescription program is not same for all patients. It is depending on what issues you have. Via the exercise testing, we calculate the HRR and how we give them the exercise prescription. So our main thing is having a customized exercise program is very important rather than just doing the exercises randomly. And most importantly, as I said, quality is more important than a quantity workout. We don't want physical activity, we want exercise.
Absolutely, ma'am. And in the end, do you have any message for our audience?
I would definitely say, I always say in my lectures as well, that prevention is better than cure. So, most importantly, I would say before you reach to any other major issues, if you have a risk factor, since we're talking about blood pressure, any symptoms you see related to blood pressure, you should definitely check your BP regularly. That is more important. Most importantly, do not forget that high blood pressure is a silent killer. Okay, when it comes and whether it affects you with any paralysis, stroke, or any other issue. So consider high blood pressure as a silent killer and keep a regular check of your BP levels at least twice or thrice in a month.
All right, ma'am. Thank you so much for being here with us today.